cramped living conditions in prisons would provide the ideal environment for outbreaks of the contagious disease. With me now is DeAnna Hoskins. She's the president and CEO of JustLeadershipUSA, an organization that advocates for the protection of incarcerated people. DeAnna, your team announced the Just Us campaign, which calls for transformative and immediate legislation that would protect incarcerated people. What are your main policy recommendations?
So as we know, COVID has just made it national, but we have experienced pandemics over and over again. Hurricane Katrina, Hurricane Sandy, and there was never an evacuation plan to preserve the lives of the individuals serving in correctional facilities. Louisiana had an evacuation plan for cats and dogs at the Humane Society, but not for the human beings. So our legislation is saying that there should be an emergency management style plan within the criminal justice system. That if a declared pandemic takes place, that DOC is authorized without legislative and judiciary oversight to start addressing the issue at hand. So when we started talking about social distancing, they should have been authorized to start releasing people within 12 months to the door. Individuals who are at high risk with compromised immune systems. There's never been a plan, and we're continuing to see prisons be a petri dish, and we have to have legislators make a decision and lead to even preserve those individuals.
So much about the moment that we're in and the movements we are seeing across this country have to do with centering people who are most affected by policies in the center of these conversations, in the center of these movements. How does having formerly incarcerated people weigh in on these policies affect the way that these policies are then shaped?
Simply by our lived experience, we are the experts at the table. Legislators don't understand how the conditions inside a correctional facility or what do you have access to. So policies look good on paper. When people with lived experience are not at the table, they don't play out in implementation. One of the things that we see is that you don't talk about women reproductive rights without women at the table. You don't talk about veterans without veterans at the table. You can no longer talk about criminal justice without individuals who have been directly impacted by the system at the table, because you're making decisions on our lives without even understanding the impact of incarceration has on us. So we have to lead this moment.
This is, of course, about the effect of the coronavirus pandemic on incarcerated people, but this also connects to the larger conversation we are having about public health. Connect the dots for me between making sure that this virus does not spread in prisons and the larger communities of which these people are a part.
So let's honestly be honest about this. People who are in correctional facilities are the only individuals in the United States guaranteed health care. They are sentenced and remanded to the custody of care of the state. And when the state fails to act in their best interest around their health care, the state is at fault. So when you look at the health system, public health issue, we are creating, you have people in an environment that is impossible to social distance. Hand sanitizer is a contraband. Running water is not always feasible of hot water to wash your hands. We're not doing laundry. And then we're seeing correctional facilities resulting to solitary confinement as a way to keep control of the environment because their staff is actually getting sick. So if you look at governors and state elected officials who are failing to act on COVID, are not only jeopardizing the lives of the individuals in correctional facility, they are actually putting their staff who work for the state at extreme risk because those individuals are essential employees. The prison doesn't close down because of COVID. Correctional staff continues to have to show up. And when the state doesn't address to create a safe working environment, they're also putting state employees and their families in those communities at risk as well.
Mm-hmm. DeAnna, thank you for your time.
Thank you.
A WNBA superstar put her career on